Now you're in.
Thank you. Good afternoon, everyone. I'm so happy that you were able to connect with us today and share this last part of the three-part webinar series. And in this occasion, we're going to be dealing with grieving process, dealing with loss during a pandemic. Before we officially begin, I declare no conflict of interest in this presentation. So the objectives for today is to identify types of grieving during a pandemic, know about the grief process and how it varies among people, and to provide strategies for managing grief during a pandemic or difficult time. Before we begin talking about the grieving process, there are important terms we need to talk about. And these are the three important terms. The first one is loss. The second one is death. And the third one is grief. When we talk about or refer to loss, the as common definition is the act or fact of losing something, or harm or distress that comes from losing something or someone. So it is important for us to know that there are two types of losses. Losses can be classified as primary, that are typically tied or associated to major life events, such as the death of a loved one or a job loss. And there are secondary losses, which are the loss of relationships, recreation, and social support. During this pandemic period, we may see many secondary losses.
Excuse me, Dr. Landers, are you sharing the
Yes.
presentation? Because we cannot see it on screen.
Yes, I'm sharing. Yeah.
I'm sorry.
Yes, I accepted the request to share. I don't know if there's something else I need to do.
I'm going to send it to you again.
Okay.
I have a lot of the attendees saying they cannot see it, but I cannot see it.
Okay.
So let me see. Let's see if, and it says, I'm waiting to view your screen. Try to go to your sharing tab and select the PowerPoint program.
Okay.
Here? Now we can see it. Yes.
Now you can see it? Okay.
Yes, thank you.
Thank you. Sorry. Okay. No, it's okay. Thank you. So we were defining, right, the three important terms. We began with loss. And now we're going to talk about death. And death is probably biologically seen, right? Because it's just the act of dying, the end of life, or the total or permanent cessation of all the vital functions of an organism. And finally, we have grief. And grief is defined as a reaction to a loss. So in a way, these three terms are related among them. The Cedars-Sinai staff into 2020, addressing what we're living through this pandemic, cited that we live in a culture of needing to look as if we've got it all together. So grief becomes the antithesis of that, and we need to embrace the grieving process. So loss is an intrinsic part of life. We can't go through our lives without experiencing some loss. So we need to give ourselves time and space to mourn. Elizabeth Kubler-Ross is one of the persons that, or professionals that has studied the grieving process, right? And she established or created 5 stages of grief. The 5 stages of grief, and probably you have heard this many times before, is denial, anger, bargaining, depression, and acceptance. We're going to go through each of the stages so we can understand them a little bit better. Denial is the first stage in the grieving process, according to Kubler-Ross. When a person is in denial, there are some actions or reactions that can accompany that stage. First, we can see or observe some avoidance, confusion, shock, and fear. Some common expressions that we can listen or hear from people that are going through the denial stage could be, this can't be happening to me, because it's the stage where you can't understand what's going on, or why is this even happening. Some people may refer to it as a nightmare, or I'm waiting to wake up from a really bad dream. So we can also hear people or experience people saying what's going on, but if everything was fine yesterday, and this happens mostly when the loss is sudden or unexpected. The second stage in the grieving process is anger, and some reactions that we can associate to anger is frustration, irritation, and anxiety. The expressions related or associated to people, that are in this specific stage could be, why me? So it's a way of trying to understand what's going on or to deal with it. This is not fair, and who is responsible for this? So in the anger stage, sometimes people are searching for answers or for explanation that could help them understand what really is going on. The bargaining stage includes reactions, diverse reactions from people, in where they tell their own story. They try to find meaning to what just happened. And there's a lot of reaching out to other people, family members, friends, coworkers, or the usual support system. In this stage, it is typical to hear people trying to bargain. Like, for example, I'll do anything to turn time back. If I only could have done things differently, or just let me be okay, because it's an overwhelming process. During the next stage is depression. During depression, we could experience the overwhelming feeling, and we could feel sadness, helplessness, and hostility. This stage specifically is sometimes associated with people feeling like they've gone back to day one, because after they've been through the first 3 stages, they start feeling sad again. So in therapy specifically, there's a lot of patients that are going through the grieving process that when they enter the depression stage, they think that they're going back in their treatment, right? That they're everything they were able to go over or go through has come back. And it's not necessarily what this means. Usually, when patients are in the depression stage, according to Kubler-Ross, they're they're closer, to accepting what has happened. So during this process, during this stage, people might express, I'm so sad, what's the point? I miss the life we had before this. And finally, the final stage, the 5th stage, is acceptance. During acceptance, we can see that people start to explore options. They have new plans in place, and they start or begin to move on. Here, expressions like, it's going to be okay, I can take control, or I can manage this are usual or common. So Kubler-Ross expressed of grief, of the grieving process. Not everyone goes through them in order, okay? And they can also skip them entirely. So the grieving process doesn't have to be the same in every person, even though the loss is the same. So in a family with many members, each member can experience grief differently. That doesn't mean that they're doing it correctly or not. It means that it's the way in which they are dealing with the loss. It is very important because sometimes when we explain this process to our patients or even to our students, if we are in school counseling or school psychology, they might think that they have to accomplish each stage or that they have to go through each stage. And some of them may ask, but I haven't felt anger or I haven't gone through depression. And we need to reassure them that it's okay, that everyone deals with grief at their own pace and in their own way, because it all depends on our own resources and our support system. So in children, it is different than from adults. It is important to note that children depend on the guidance and assistance from adults in order to cope with the emotions that come with a loss. So it's very important to know that they're more vulnerable in this when we look at it this way. So if it's left untreated, complicated grief can persist over time. Sometimes conduct or changes in behavior, lots of anger, violent actions are related with a grief that hasn't been treated. So this is very important. In Hispanic and Latino children, it is important that when not showing emotions or displaying manly attitudes, it's the correct way to go, okay? And not questioning. So this is very common in Hispanic and Latino children that probably they won't question because they don't want to be a burden to their family, and they think that their role is to help those that are suffering more. So they tend to suppress their feelings in order to help others cope. So as mental health providers, we need to be mindful about each student's specific cultural values and social norms because their grieving process is going to be different depending on these characteristics. Okay? Extended members, especially in Latino communities and Hispanic communities, like cousins, grandmothers, uncles, and aunts, are useful resources in helping the mental health providers when trying to explore traditions and values. So children, Latinx children may show grief different than adults, okay? They may have or experience a hard time understanding and coping with a loss of a loved one. Sometimes children appear sad and talk about missing the person or act out. Other times They play, interact with friends, and do their usual activities. So this is what makes it more difficult when dealing with children, that their coping mechanisms are very different from the ones from adults. So when we see a child that after a significant loss still goes around and plays, it doesn't mean that they have coped correctly with the loss. So this is very, very important. Usually I tell my students that then when they are interviewing parents for a evaluation or for dealing with a case, that it is important to ask about significant losses and the specific times in which they occurred, because these losses may explain many of the behavior that children are experiencing at present time. Also, during this pandemic, there have been measures that could also represent a big loss for children. Like, for example, losing their routines, losing going to school. We cannot assume that children are happy because they're not in school. Usually, children will say, I don't want to go to school, I don't want to take this class, I'm tired. But now that they have been disconnected from their routines and their schools and teachers and peers, it has been a great loss for them. So it's not only going to school as a representation of an education process, it's also the memories they build, the relationships they have in school with their teachers, with cafeteria employees, with their friends. So it's more than simply going to have a class or take a class. So also, parents and teachers and caregivers play an important role in helping children process their grief. Also, the immediate and extended family plays a major role in the area of death and dying within the Latino culture. Large family networks provide comfort and practical aid while grieving. When grief is expressed and practiced in Latinx culture, and usually rituals and practices facilitates the grief process as death and dying are prevalent parts within the Latino culture. Crying and wailing are often expressed as seen as a sign of respect and love. So it is important for us to understand the Latinx culture so we can view the way in which they cope with the grieving process differently from other cultures and understand that it is totally normal in their culture to cry, to pay respects, to wear probably t-shirts, to have special music, to use black. So there are some characteristics that we need to understand. It is found in Latinx culture that men don't show, right, demonstrative acts of grief. So crying and wailing is not usually seen as a expected reaction or demonstration of pain in Latinx culture men, okay? Instead, they are expected to grieve in a reserved manner. So this is usually associated with what it's called machismo. Okay, so it is none other than expectations that Latinx culture has of their men. Latino and Latinas experience grief deeply and intensely when compared to other cultures. So sometimes the duration, frequency, and intensity of the grief process is impacted by the manner of the death and the family's culture belief. I don't know if you are still seeing the presentation? I hope so. So something happened,
Yes,
but
we can see it.
you can see it. Okay, thank you so much. So the grief process is going to vary in Latinx culture, related to how deep and intense the duration, the frequency of that process, because it also depends on the manner in which this special person died, and because of the cultural beliefs this family follows or believe or has. So when a death is unexpected, and we know that Latinx culture specifically is more vulnerable to probably unexpected deaths. So and especially if it involves the death of a child, these are very, very intense experiences for which Latinx culture tends to grieve more deeply. So Latinx culture is a relationship-oriented culture. So they focus on attachment as opposed to a detaching from the disease. Okay, so as part of their grief process, there is more of an attachment to the loss. So Latinos and Latinas hold a general belief that there is a continuing relationship between the living and the dead, resulting in rituals that honor this relationship. So that's why probably the grieving process is extended in Latinx culture, because that attachment or relationship after death or after the loss is longer and intense. So what happens because of these relationships maintaining, or because this attachment continues? Well, they're going to tend to honor that relationship. So that's why the process may be extended or longer. So there's always going to be themes related to spiritual continuity and the continuing relationship with the disease. So their content, when they're talking to us, explaining this grieving process, there's going to be these common themes in Latinx culture. Um, Doran and Downing emphasized the importance of maintaining a bond with the deceased in the Latino and Latina culture. They had a study or that found common things in the grieving patterns of Mexican American families after the death of a child. So for them, remaining connected serves as a protective factor, helping the family cope with the loss and proving comfort and support. For them, holding on to this person, even though the person is not physically present, represents some kind of support. So it's important to know this. So how do we experience grief during the pandemic? Um, so the grief in this process doesn't mean or doesn't refer only to the death of a loved one for COVID or because of COVID-19 or any other sickness or event. But grief during COVID-19 may mean the loss of a job, the inability to connect in person with friends, family, and or religious organizations, which mean a lot in Latinx culture. Missing special events and milestones. This has been very, very important. Just the other day, I watched a high school graduation. So it means how important this event or celebrating this milestone is for youth along the whole world. So when you miss special events or can't celebrate those big milestones like weddings, vacations, it is experienced like a grief. Also, drastic changes to daily routines and ways of life that bring comfort. Also, the loss of control. Um, many of us are used to knowing what's going to happen, taking care of others, or deciding what's going to go on today, tomorrow, next week. And when we don't have control of that, or we lose control, it can be experienced as a grief also. You may also feel, according to the CDC, a sense of guilt for grieving over losses that seem less important than the loss of life. And this is something we have to deal with constantly, because we can hear people or listen to people say, I shouldn't complain because I cannot go to school when there's people dying in hospitals, or because there's doctors who are giving all of their time and energy to saving others. And that seems like the correct thing to do. But what something means to a person, it's very important to validate it. So you grieve towards the things of because of the things that you are losing. So that is important to help people understand that they can still grieve for things even if they seem less important. So you need to acknowledge and recognize everyone's individual sense of loss. Grief is a universal emotion. There is no right or wrong way to experience it, and all losses are significant. So, how to cope with grief? What do we do? First of all, you need to acknowledge and, us as individuals, but help other acknowledge their losses and feelings of grief. We need to find ways to express your grief, us as an adults, with other adults, and also help the children and youth find ways to express grief, and let them know that it's normal, that it's a process we all can go through. So some people express grief and find comfort through art, gardening, writing. Writing is a very useful coping skill. Talking to friends or family, cooking, listening to music, gardening, or other creative practices. So it is important to let everyone express grief in their own ways. It's very important to allow people or let people know that they can develop new relationships with loved ones to replace those that have been lost. So people who live together may consider, for example, playing board games and exercising together with other people. Your sadness or your grief it seems like less heavy, so we can deal with it much better. When you live alone of you, or you have to deal with people that live alone or are separated from their loved ones, you can consider interacting watching movies together, or doing many other activities. And now because of the situation we're living right now, there's a lot of opportunities online to stay connected. Nothing can replace a physical encounter, right? Nothing can replace seeing someone, nothing can replace a hug, nothing can replace sitting next to someone and having dinner. It can also be okay. So if you're worried about future losses, you can consider interacting with other people right? Right now, there's no certainty of when things can go back. It's important to stay focused on here and now. Focus on aspects of your life that you have control over now. Things that are going to happen or might happen in next week, next month, or even tomorrow, we don't have any control over. So those are energies that we are using in things that we don't know if they even are going to happen or not. So it is very important to focus here and now. For with children, it is important to ask. We need to ask them how they're feeling, what's going on, and to the only way we know how they're understanding what's going on is to let them talk about it or express it in some way. There are kids that are going to be have more difficulty expressing themselves orally, so we could do it through drawings or songs. With youth, we can also use these options. For example, I have a youth in therapy, and he has difficulty expressing his emotions, and that's what we're dealing with in therapy. So he is a great drawer. So 2 or 3 days before each session, he'll send me one of his drawings through email so I could see it, and he would express what he was trying to let me know. So we need to identify ways in which children and youth can express themselves through creative ways and things that are easier for them. So we need also to give them permission to grieve. As we mentioned before, probably in Latinx culture, children will suppress their feelings in order to help others feel better. So they need sometimes, or they wait for the permission coming from the adults. And this happens a lot when families go through divorce and one of the parents is sad or is not coping very good with the situation, and kids seem to think that it's their responsibility to make that parent feel better. So as adults, we need to understand that sometimes they need our permission to grieve, that we need to give them permission to have time to be alone, to talk, to express their feelings, and to have bad days too. So they need that permission. You're having a bad day, okay. You have the permission to have a bad day. Always when dealing with grief and dealing with pain, we should provide answers that are appropriate for child and youth according to their age and development. So it's not the same to say that we're going to answer some questions to a 6-year-old who is more mature and more open and has experienced more situations like of loss or grief than to another 6-year-old that hasn't experienced loss or grief before. So we have to take into consideration the age and the developmental stage in which they are. Also, we need to practice calming and coping strategies with your child. Let them know that it's okay, but we can breathe, we could take a break, we could calm down, and then we're going to find ways to deal with them. It's very taking care of yourself is a way to model cope, to deal with our own emotions and to figure out strategies to your child. So it is very important if we are dealing correctly with what we're feeling. The routines are very, very beneficial for children and youth. So as long as we can maintain those routines as much as possible, the coping is going to be better. It's important also that to spend time with your child reading, coloring, or doing other activities they enjoy. Right now, it seems that because we are home most of the time, we are always working and doing things for school or things or homework or studying for tests. So it is important that we separate or identify time in our schedule for having a good time, for doing silly things, for enjoying ourselves. So it is part of having a balanced schedule or routine. Um, when we are dealing with loss, it is important to find meaning, and it is important to the grieving process. In Latinx family, faith is a very important element, and that is very important for us as teachers, as caregivers, as counselors, as people who engage with youth and children usually or on a daily basis to understand that. Because Latinx families can see faith as a tool or as a coping mechanism that helps them get through the pain and the loss and the grief. So Reverend Laser cited that having faith can help us understand our loss and find a sense of meaning and hope after loss. It is very important to acknowledge this in certain cultures in which faith is so important, one of them being the Latinx families. Faith might not be a religious faith. It could be faith in our own resilience or our connection to community. So acknowledging this, it doesn't mean that we have to have the same beliefs or that we have to understand where this is coming from. We just need to acknowledge that Latinx families have these cultural beliefs or general beliefs that distinguish them from other cultures or other families. This will also help us identify specific coping skills for these children and youth and also the adults. However we view it, having faith can have a very positive effect following grief or loss. And it is important to acknowledge that, as I stated before. In these difficult times, there are layers of loss going on around us. We mentioned primary and secondary losses. So we need to be patient with ourselves and patient with others. Patience is something we need to develop, especially in these times, because there's so many things going on, because things change from day to day, because we have lost total control of what we do, of what is permissible and what not, on what's going to happen or what not. So on the sense of normality, on getting back on track. So patience is something we need to develop, and we need to model to the younger ones, and we need to show them how to be patient too. There are some warning signs that we should, as adults, be aware of, okay? Specifically, one of the main warning signs is changes in behavior. Like, for example, in children and youth, and even in adults, we could see acting out. Obviously, in children and youth, we're going to see this acting out in other ways, but in adults, the acting out also occurs. So we have to pay special attention to that. When we see that the interest in daily activity changes, and what was very important before or what caused so much happiness before, now it's not important at all, that is a warning sign. Changes in eating and sleeping habits, eating more or eating less. The same with sleeping. People who sleep more or sleep less are probably going through some difficulty. Persistent anxiety, which is worrying about things that haven't happened, or if they're nail biting, if they're moving their hands. Some of in children, we could see that when they don't understand something, they start talking by themselves, or they can sing by themselves. Also sadness and or depression, which is a more intense form of sadness. Remember that sadness is an emotion. So sadness doesn't mean that a person is depressed. So a person that is depressed has to be sad. So sadness is by itself is a simple, it's just an emotion that we can deal with. Depression is a combination of sadness, of changes in eating habits, in sleeping habits, etc. If troubling reactions seem to go on too long, or they interfere with school or relationship with friends or family, and this is very important. Some parents and even teachers consult me and ask, how do I know if this is a problem, or if I need to seek for attention or help? And I say, how well can a child, a youth, or an adult can function? If this problem or this specific situation or symptom is affecting their daily living activities, that is something we should pay attention to. If you're not sure if your child is 100% okay, if there's something that concerns you as a parent, caregiver, as a teacher, there's nothing to lose acting upon it. Okay, so we can always have that sense of that we saw something or we're feeling something that's not right, and we can act upon it, refer to a professional, and just get it straightened out, see if there's something going on or not, so we don't lose anything by referring or asking for help. Okay. So as a closing statements, I found these two when researching this article that was written by the Cedars-Sinai staff. You've seen that I've cited it or referred to during the presentation. And the first one says, we can't go through our lives without experiencing some loss. We need to give ourselves time and space to mourn. This is so true. Each and every one of us can experience loss in any way. Okay, and as we've seen, loss is not only it not only refers to losing a loved one or someone special to us, and it doesn't mean that the loss has to be due only to death. We could lose someone, or we can experience loss of someone that had to leave the country, someone who moved from our area into somewhere far away. We can experience loss through separation or divorce. So we need to pay attention and know that loss doesn't only mean a loss or separation by death. And also, we need to give us time and space to mourn. Sometimes with many of my patients that are going through a grieving process, they don't even know that there's such a thing as a grieving process, because it depends on so many factors, right? If they're a caregiver, sometimes taking time seems like a luxury or something you're doing and you're not entitled to. So when I explain this grief process or this grieving process, sometimes they are like in awe because they didn't know there was such thing. So we need to explain the grieving process. We need to let people know that experiencing loss is part of life, and that we need to have the time to experience it. Also, we need to let them understand that when there's something significant for you and it's not there anymore, that is a loss. And it happens a lot with people going through divorce. um, I let them know that that's a kind of loss, and that refers to or needs to go through a grief process. So also, when we say to give time and space to mourn, we need to do it in the moment. It's very difficult because you are not losing this person again. That first loss, if it's by death, obviously it's going to happen once. So you need to experience that a pain, that sadness in that moment, because that moment it's not coming by again. So we need to have and allow ourselves to have time and space to deal with that. Also, the second quote says that sometimes people aren't aware that grief is what their experiences. So giving grief a name can be a relief and help put what they're feeling into context. So this goes hand in hand with what I was just explaining. People may be feeling, children, youth, or adults may be feeling intense emotions, may be feeling uncomfortable with themselves, and they don't know what's going on. And because they don't know what's going on, it's difficult for them to express. So sometimes they feel that they are strange, or that this is not normal. So when you explain to them, yes, what you're feeling is grief, and it's grief because you have experienced a loss, people begin to make sense of all that mix of feelings that or emotions that are going through. So it is very important to give everything a name, to let them know that this is grief, and that grief is normal, and that grief is a response to a loss. And also identify the different types of losses that we can experience. So loss not only means that it's by death, and that it's someone in your family. Okay, loss could be letting go or separating from people that are important or special to us. Kids can be suffering grief or pain from losing their teachers, right? And when I mean losing their teachers, they have lost their hugs, they have lost their attention, they have lost their modeling, right? So there's a lot of things that are lost through virtual learning. So we need to let them understand that it's okay. You're going through a grieving process, and that means that you have lost something that is important to you. So let them express themselves, and let them uh, tell you or let you know what they're feeling and how they're dealing with it all. Okay. So there's important facts that I like to repeat, right? There's only 1 in 5 Latinos with symptoms of a psychological disorder approach a doctor. So this means that sometimes taking care of themselves or identifying difficulties in themselves is more difficult. So because of this, only 1 in 10 Latinos approach a mental health professional. So I think it's our job to let them know that it's okay. It's also our job understand cultural factors that could be having to do with this kind of statistics, and help them know that it's okay to feel and to go through difficult moments, and that help is available for anyone. So I always emphasize in asking for help. For me, is the best recommendation, okay, to let people know that it's okay to seek for help, that you can identify available resources through your family, through your friends, through your co-workers, other parents, community members, peers, your support groups, different support groups. It is important to let people know what you need. It is very frustrating at times that maybe a neighbor is going through a bad moment and we don't even know about it. So you cannot receive help if others don't know that you need it. And also there are mental health professionals available in every size, every different approaches. You have in United States, for example, school psychologists that can help with children and youth. You also have, if you don't know of mental health professionals, you can also ask your main physician or in somewhere where you get your physical health checked out. And also you can always access the crisis hotline, which mostly are available 24 hours a day, 7 days a week, and they are confidential. So you can just express what you're feeling and they could give you options, or they could refer you to a mental health professional that could provide direct help. So this is all for on my part on this theme, so or topic. So if right now, if you have any questions, I am more than available to answer them.
Okay. Hi, Dr. Landers. Let's go to the questions. We have, what role does religion play in the grieving process?
Yeah, in Latinx culture, religion plays a huge role. As I've explained, faith is a seen in this culture specifically, and in Hispanics, Hispanos along, and many other cultures too. But it's a coping mechanism that helps them because it provides the faith, right? And sometimes faith helps you view the grieving process like something normal. And in some religions, this loss, if it's a physical loss, like by death, it gives you like some sort of tranquility or calmness, because you know that you're gonna reunite with this person eventually. Okay, if it's other types of loss, faith helps you find or understand that things could be better, are gonna be better. So religion does have a very important role. I can risk myself and say primary role in many cultures.
Thank you so much, Doctor. We have another one that reads, when does the normal grief process start to become a mental health concern?
That's a very good question. That's a very good question, because we know that when people are through the grieving process, we can talk about bereavement, right? And we could give them a grieving process space. There are times, or some people say 6 months, some people say a year. And my answer to that is it depends on how functional a person can be. Okay, a person can be in the middle of a grieving process and still go to work and still do their own things and go to school and function quite well. So to me, it's going to depend on how much the grieving process affects their daily functioning. Okay. It also is going to vary according to culture, because as we said, Latinx culture, for example, can have a more intense grieving process or a longer duration. So I think that every case is individual. I think that we need to address how this person is dealing with it and how this is interfering with their daily functioning. That is going to determine if this is still a grieving process or if this has activated other symptoms that can comply with another diagnosis. Yeah.
Great, excellent. We have, what approach do you recommend to treat complicated grief?
When we deal with complicated grief, it is very important to understand what type of grief it is. Why did it turn into a complicated grief? So we first need to understand what type of loss are we talking to and why it became a complicated grief. So once we determine what made this grief so complicated, we could act upon that. For example, if it was lack of expressing their emotions or lack of support, or we need to provide whatever made this grieving process so complicated. So we need to identify what made it so complicated, turn into complicated, and probably it is because it wasn't attended, because it wasn't, we didn't see it and we didn't pay attention. So we need to address it according to the needs of that specific person, and then follow the recommendations of when dealing with a grieving process, a normal grieving process.
Thank you so much for your answer. Um, we have here, I read that a healthy grieving process should last about 6 months. What is your opinion on this?
Yeah, my opinion, as I stated before, is that yes, this is a guideline which we follow to have like something to compare the grieving process to. But the grieving process is going to depend on many factors, and it's going to vary from person to person. As I stated before, 6 months is what the usual time that we give, but this is based on guidelines that probably don't take into consideration many cultural factors. So yes, I would say that 6 months is that like the timeline or the time frame that you're gonna have there in the back of your mind. But it could be more or less depending on the specifics of the person that is going through the process. And what specifics, culture, very important, their beliefs, their support systems, and the way they can be able to function um, even though they're in this grieving process. Okay, so it's their ability to overcome it. We can see if we can. I think we could spare 2 months, 3 more months. I would evenly say we can probably give up to a year, but at the 6 month point, we can assess how are we dealing, and we can probably have a projection of how this person is gonna overcome this. So yes, 6 months could be like that time frame in the back of your mind, but it's okay. In my opinion, it's okay if you can provide them more time depending on how they're dealing. Okay, if you're at the 6 month point and you see this person hasn't moved a step in the recovery process, well, that's a red flag, and that's something that's telling us something. But if the person at the 6 month mark has accomplished many things and has gone through the stages and is going on, I will, cut them some slack for a couple more months.
Thank you. That was very interesting. We have a couple more questions. Do you have any suggestions on how to work virtually with children who are experiencing loss?
Yeah, I'm gonna be very honest. Virtually, it's very, very difficult to deal with children in therapy sessions. In my opinion, or in my experience, I should say, it's been very difficult. I just began working with children, and there are 11 and 12-year-olds, and it is difficult because we need that contact, and we need the, to having the control that we can have in an office space or a designated space. So it's a bit complicated. I'm quite the optimistic, but yeah, and it's complicated because of the lack of resources that we could have, right? In our offices or our spaces, we can have access to different types of activities that are fun, that could help them in the healing process. So virtually, it's a little bit different. Also, we don't know um, how private this connection is, and if that child has a space for himself or herself to express freely. Okay, so it makes it a bit complicated, and because it's like a healing process, it requires deep connection, it requires deep expression of feelings, and it also probably represents a difficulty for us as mental health workers, because there's always the worry of the reaction, or how this child may react to certain activities, certain questions. So that lack of control that we may have, it's going to make it difficult. So my recommendation is to do the best that you can with what you have. There are many online resources that can help you, and I will give it a try, because every child is different in their own ways, and probably it might not work with someone, but it probably could work with another one. So yeah, just give it a try, but it's very, very difficult.
Let's see. We have another question in that kind of line. Let me see. How to support our young males when going through grief when they are not allowed to express their feelings?
Yeah, that's a very, very good question. First of all, we need to understand where this rule is coming from, and if it's a cultural learned, right, or a cultural belief, we need to understand and give it some purpose. Okay, but dealing with this is letting them know that it's like with evidence. We need to let them know what crying means. We need them to, it's kind of an education process, letting them know that crying is a normal reaction that is expected, and that it's okay if your culture states that you have to be the strong one, but that doesn't, maybe you don't have to cry in public, but you could find a way or a space to cry in private. So it's changing that idea that not crying at all it's not very, very helpful. It's not good coping mechanisms. So it's more the education part and showing evidence, to let them know why crying is like a biological process that everyone has to go through, and that we respect, if it's a cultural belief, that we respect that, and that probably we can find ways to do it that it's not seen as a disrespect to our culture.
Perfect. Thank you so much. Um, with with all of us going through this COVID pandemic and so many lives has been lost, how can we support one another through social distancing at a time when we should not be next to one another or hold one another? What are other ways to support each other?
Yes, that's a very good question, and it's totally true. We're all going through this. So this, instead of being like something negative, should start, should begin to see, we should begin to see it like an opportunity, or to let us know that we are not alone in this. So um I always believe that difficult times also are opportunities for us to explore the better things, or the better parts of us. So it 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 requires a lot of our creativity. Nothing replaces a good hug, a good kiss, um, a good laugh with our friends, or watching a movie, or sitting at the park. Okay, that and probably we stress ourselves too much because we are trying to find something equal. Okay, and there's nothing that compares to a hug, for example. But what can give me something um, similar to what I feel with a hug? Well, maybe a video call, or maybe a drive-through, or maybe the chats, right? That we could have, text messaging, calling, we having, doing things that we forgot that were there, right? And probably now we are talking more on the phone instead of texting. We are FaceTiming. We are finding ways to be together, and I think that is what we need to focus on. How can I connect with you with what I have? Okay, so I think in the last the webinar before this, I explained that there are some ideal situations and there are some real situations, right? Ideally, I would love to relax in a spa or in a 3-day getaway, but right now I cannot do that. So how do I relax, which is my objective? How do I relax with what I have? Okay, so that could mean being alone in my room, locking the door, turning the phone off, lighting a candle, and having that space for 15-20 minutes. So the same goes. How do I connect, or how can I be present with my loved ones or for my friends with what I have? So I think that when we start concentrating on that, this is what I have, how can I make it useful, and not trying to get the same reaction or the same feeling as things that are physical, right? And that are contact related. How can I get something similar? So that lowers the expectations a little bit, and it fulfills the needs for now. Okay, because this is something that we're gonna get over with, and it's gonna be over sometime soon, and we're gonna be able to do the things we used to do before. So in the meantime, we need to find like a replacement that is not 100% what we were looking for, but it can do in the meantime.
Okay, we have time for maybe two more questions, if that's all right with you, Dr. Landers.
Yes, that's okay.
Okay. How to distinguish between grief and depression, and is it different for adults than children?
Okay, the main difference between grief and depression, it could probably be the loss. Okay, for you to be going through a grieving process, there has to be a loss, some kind of loss, primary loss, secondary loss, death, loss by death, loss by separation. So there has to be a loss. Also the time frame, right? Uh, if we, as I answered in the question prior to this one, the symptoms have to be present for 6 months for it to still be a grieving process. So if we see that it's more than that and time related, or that people went through the 6 months and this extends for a longer period of time, and also the intensity of the symptoms. Obviously, when you are diagnosing a depression, one of the criteria is that there's not a grieving process in place, right? So you have to, in a way, try to identify if this is still part of or solely related to this loss, or this has become something bigger. Okay, this has now moved or gotten bigger than a loss or a reaction to a loss. Okay, so it's probably that the intensity of the symptoms, it's also a criteria. So it's basically time, intensity, and if it moves a little bit further from what a loss is.
Great. Next question. How to work with a family whose father is in denial and youth having lots of behavioral issues?
Wow, that's a and I'm sorry for the prior question. It is different in children and adults, only probably in the way they express it and deal with it, but the criteria is the same. Okay, so you're gonna also have to see how the behaviors or the reactions respond to the loss or respond to other things, and the coping mechanisms also, right? And the way they're trying to express. So yes, and denial is so difficult to deal with, and my first response will be evidence. We need to provide evidence of what's going on. We need to provide examples. We need to provide research. We need to provide forms of educating these parents and letting them know. Sadly, uh, um, what's normal in some parents is wait for prevention sometimes is not a way of seeing things, and they wait for things to get out of proportion. So my answer is educating, providing information, providing evidence, and letting them know what your impression is. Okay, so sometimes that has to be enough in the time being, and sometimes it's frustrating because we have all the evidence, we have all the information, and we provide it, and parents don't want to see it. So sadly, there are some cases where we need to draw the line and recognize that we've done everything we can, and it's time for the parents to gather that information, process it, and hope for them to recognize that it's a problem.
Okay. Last one says, What about those who say it's a family business and they will handle it within the family?
I guess it's the grieving process or the loss, dealing with the loss. Yeah, this can happen, and this is totally well, it's their it's okay if families say they're going to deal with it in their way. Okay. Our roles as teachers, as caregivers, as mental health professionals, counselors, is to monitor how they're dealing. Okay. If we our main interest is seeing how the child, the youth is coping. Okay, so if this works for them, well, we need to respect that. Okay, we need to respect that because it probably has to do with many factors. Okay, cultural factors of upbringings, right, beliefs, religious beliefs too. That sometimes in Latinx cultures we say that the problems are dealt in home. Nobody has to know, and that's okay. That's fine. Always, when we see that the well-being of this child or youth is not affected. Okay, so if that works for them, we need to give them that space. If we see that the child or the youth is not coping well, then we can address the situation not based on the family's coping mechanisms, but emphasizing on what we are observing in that child. Okay, so there's a very thin line uh, that we cannot cross. We cannot say you are not doing this the correct way. Okay, no, we just need to observe that child or that youth, and if something's not working or something's not right, we need to address that. Okay, I observe that so and so seems sad, or so and so is reacting with anger when someone speaks to him. So we direct our attention to things we observe, and that we can have evidence. We can provide evidence from the style they use for coping, or the coping mechanism each family chooses to do. We need to respect that. We have to observe how that is impacting, or how the child or their youth are dealing with that.
Thank you so much, Dr. Landers. That was an amazing presentation, and we always have good feedback for your question and answers session. I don't know if Dr. Miranda is online with us. Let me see.
Yes, I'm here.
Anything you want to
You hear
say?
me?
Yes, we can hear you just fine.
Okay, thank you. Thank you, Dr. Landers, for sharing with us your knowledge about how to support Latinx students and caregivers' emotional and mental health well-being during this public health crisis. We want to let you know that this webinar will be repeated in Spanish on October 13, October 20, and October 27. For those of you that prefer Spanish language or your colleagues, please share this invitation. The information is in our website. We also want to let you know that the upcoming webinar, The Evolution of Latino Identities and Mental Health, that is a collaboration with the Pew Research Center. This is in celebration of the Hispanic Heritage Month, promoting cultural responsive mental health services for Latino agricultural workers who bring the food to our table. And also we have another series of webinars regarding this celebration. The title is Institutional Racism and How It Impacts the Latinx Experience as It Relates to Behavioral Health, TTC series. This is a collaboration with the Hispanic and Latino ATTC, PTTC, and AMHTTC. Also, this is the last part of this webinar series. You will receive an evaluation form. It only takes about 2 minutes to complete it, and you will be supporting our work. The certificate of attendance will be received in your emails after 2 weeks of your evaluation. Thank you so much.